Hi everyone, in this video I'm going to talk about some children and also health related issues in the family life, which if not addressed properly in our current phase of earthly existence is going to lead to further escalation of health problems in our human existence, simply because of the lack of awareness, lack of attention, lack of understanding, lack of uh, all these things in multiple aspects, where people are incapable or living in denial about the level of problems that are existing on earth currently that impact our health. And when there are actually some groups who are indeed aware and understand what the problem is, they do not want to acknowledge that they are also part of the problem. And also, when in trying to fix the problem, some of the fixing of the problem is not happening in the right level, because the level of awareness or the degree of changes that are truly necessary to fix a complex problem is currently missing from many people's lives, because people do not understand that when 10 things are wrong, you have to fix it at 10 levels, but slowly, step by step. But people instead get tired after fixing the first level, or think mistakenly that after fixing the first level, if things start improving slightly, they start to believe that the problem has been resolved, when in fact there are multiple levels to be crossed, multiple levels of things that need to be changed, patterns of behavior that needs to be changed before true change, true alignment towards good health, true alignment towards understanding the reason why certain things are manifesting on earth currently, that seem very unusual or different from the past, is actually happening with us. And to demonstrate this, I'm going to use first example of two girls, baby girls. One video of the girl's caption showed that she died shortly afterwards of recording this video. And in that video, the girl is singing a song to her mom. She's a small toddler, possibly 1-2 years old, or maybe 3 years old, because she could speak very clearly. So that toddler was singing a song to her mother. She had a drink in her hand, and then apparently she passed away afterwards. Now that toddler, whatever was being shown in the video actually indicates what was her health issue. But if her parents are unaware what her health issue is, if her doctor was unaware what her health issue is, like, I'm not saying that they were completely unaware or clueless. She seems to be living in a home where, looking at the clean environment of her home, looking at the fact that she's drinking from a cup that you will usually buy from outside some expensive place, she seems to be in a moderately good income family's child. So it's not that she's not getting access to healthcare, or she didn't have access to doctors or something, but this is a child, despite having access to doctors, despite having a mom who seems to care about her, they don't care deeply enough to delve deeply into what is going on with her life at that point of time. They do not have the awareness, self awareness, awareness about a baby's life or health beyond what the doctor is telling them, to understand that something deeper is going on in her child's life. And the fact that whatever was transpiring in this child's life, if understood slightly better, if they have a different child now, or if there are other families who have children her age, the same factors that resulted in her death would not result in death or severe hospitalization or worse health conditions for other children of the same family. So every time you understand that a problem that led to death, a problem that led to hospitalization, a problem that is leading to distress in someone's health, every time you understand the deeper aspects of the problem, you are not only able to solve that problem for the particular person who may or may not have been saved given the circumstances of their life, but at least if that baby couldn't be saved, if people understand deeply what was going on with that baby, every future baby who is suffering like her will not suffer. Every death related to babies like her will be of benefit to those babies who are going to come after them, who have similar life circumstances, similar problems going on in their life, but similar level clueless people, less informed people, less people with an deeper understanding of the issue related humans in their life, who are not able to fix the problem in the right way because either they are unaware of the problem, don't understand they are also part of the problem, don't realize where they have to take the initiatives to change the problem, and where some initiatives have to also be taken at a deeper level, like a governmental level, regulatory level, operational level of a company whose products you're using, and multiple levels depending on how deep the problem is, how many problems are prevalent in a particular city or home life, things like that. Similarly, there was another baby whose mom has posted a caption where they're talking about how the baby, because before being breastfed, has cried a lot before being breastfed, and you can see the tears still in the baby's eyes, the sadness in the baby's eyes while it's breastfeeding. And if you look at all the comments also of the video, you will see that all the parents are who have possibly experienced the same problem of a baby's diaper being changed have commented there now about multiple things related to some are joking about how the babies don't understand, it's a good thing for them when the parent is changing. Like, they're all hinting at it. Obviously no one is directly saying that, but some people are hinting how the baby doesn't understand that their diaper needs to be changed. Some are hinting that it is such a precious thing when the baby is crying because the baby's life is only involved in just pooping and feeding, and like that all baby specific comments are there in the whole different comments of the first maybe 10 comments I read, and this is how the comments were showing up. But now, and I also posted a comment there because there's something deeper going on with the baby, where if you presume just because you're a mother and you've raised maybe 10 kids, or you have been a school teacher or preschool teacher where you were raising some smaller toddlers or breastfeeding toddlers or partly breastfeeding toddlers whose diaper needs to be changed, everyone has experienced this, that when you are changing the diaper of a baby, many babies tend to cry about it and are creating a ruckus about it. Now, I have also, as a preschool teacher, one time I have changed diapers. I hated changing the diapers, and luckily I was not there in the put in the 2-year classroom where the diaper changing was necessary for a majority of the time, so I didn't have to do diaper changing activities more than once. But I have also seen my friends change the diaper of their kids and have seen them also cry a lot. But there is another thing that people don't know about me, but I am also been a pharmacist where I had to sell diaper rash creams to parents. I have also, so I know that when a child is crying, or when a child needs caretaking, what babies need when they need caretaking at the healthcare level. Some of the things that they need for caretaking at the healthcare level, which were prevalent at the time I worked as in a preschool, or at the time when I was working as a pharmacist, those things I already know about. But in the last 10 years I haven't really worked as a pharmacist, and in last 20 years I have hardly interacted with any babies or small toddlers in my life. But despite that, very at a very superficial level, in the family life level, I haven't interacted with any babies, or at the work level also not interacted with smaller children. But despite that, I understand the problems of these babies. Why? Because people don't know about most people don't know this, but I use baby products for my own skin health problems, and I used to use baby products because adult products were giving me heavy allergies ever since I have lived an independent life as an adult in US. until I was an adult in US, living my own life, doing my own thing, earning my own money, I lived in a family where my father didn't give us financial access or control in a major ways to anyone in the family. He was the one who was the provider of money and clothes and everything to the family, but he was also the kind of father who was not very extravagant, not very spendthrift like, and neither did he give us access to money where we would become spendthrift, or I just didn't have any financial access of a major way. I just had the bare minimum finances that I would get access to when I would go to school, college, and I needed money for buying my bus tickets, or I needed money for occasionally having some snacks or breakfast in my college canteen. But I was also, because I've been brought up now in a middle class like family and a family where major financial access was not happening, I was also a very similar spendthrift kind of a person. I wouldn't extravagantly spend. Like, there were a few years where my dad used to hand me the money, like 100 rupees or something, for a 100 200 rupees for a week, and that was enough for me to take my bus fare and eat snacks. But there was also a phase after the first year where he was handing me the money. He gave me access to, he said, the money is there in our drawer and you take whatever you want. But not being extravagant kind and not being from an ultra rich family, I didn't feel it right that I need to spend that money for extravagant things. So the only things I would use that money for, at that time my mom was also very sick, so I would use the money for either doing family groceries. So while coming back from college or on my holidays, like weekends, I would go and get family groceries from the grocery store. So I would spend maybe 1,000 1,500 at that time for grocery needs. Or occasionally my dad or mom would tell me go and get eggs, or even if they don't tell me, I have observed eggs and bread needs to be bought, I would go and spend 50 or 100 rupees for eggs and bread. And I had the snacking habit, so occasionally I would buy chips or chuda or samosas occasionally with that 100 rupees that I'm spending that day. So this is the bare minimum spending I used to do. I didn't used to, like, even if I had that access to the money, never went and I used to feel like when I was younger, my dad never gave me access to money to buy expensive clothes. At that phase, even though I had the money, I didn't use the money for buying expensive clothes or doing extravagant shopping, because I somehow felt, I don't know, I felt my father's pain. I understood silently that maybe I shouldn't just use the money for anything that, if he's, I don't know why I was like that, but this is how I was, and I didn't end up being overly extravagant with any money that he gave me access to during the last few years of my college life. But when I did go to US, where I had my own money, naturally I became more extravagant, and not in the first year. Again, in the first few years, I didn't have that more money. The money, if you convert into Indian rupees, seems like a large amount of money, but for US life, it was just the lower percentage of income of US life, a lower percentage of income that is just enough to make you buy just enough money to give you a comfortable access there as a poor person. So I was not below the poverty line in the first 2 years, but I was just near the poverty line with that kind of a salary, just having enough funds to meet my usual needs there. But because I was also a mindful spender, sometimes I would save enough to go and buy a laptop after 1 2 years, and which is what all Indian students who are, or all foreign students who come from a country whose exchange rates are at such a level where US dollar is worth a lot of money in my country. So every time I would convert a dollar spending to my country's money, it would seem like I'm doing a extravagant purchase. So that's why in the first few years I wasn't extravagant. I would buy only the necessary things. The only time I would be slightly more extravagant is when I'm coming back to India for a vacation and I wanted to buy something for my nephews, nieces, uncles, aunts, and very minor things. I wasn't buying anything extravagant, but cost wise it was an extravagant cost. For me, who's earning only few $100s, if you spend like 1/5 of your monthly salary or one half of your monthly salary in buying things for your relatives in India, that's a big chunk of money you are spending. So sometimes my friend, so the reason why I'm telling you this is about understanding context, that when we are new at something, we do not end up understanding all the deeper repercussions of the thing we are new at. And also when we have new access to money, we don't know how to use the money in an appropriate way. And most of us are like this in India. Most of us, even globally, in US, maybe a teen starts understanding slowly how to spend their money if the teen comes from a family where they get their pocket money only if they earn some living in their teenage years. Otherwise they don't have access to money. And India, most of us don't have access to any personal money until we are in our 20s. After we graduate from some college, that's when most of us get access to some personal money. So, or in family life, when you are getting minor access to money from relatives, that they might give you a gift for festival time, at a time usually parents only end up spending your money for buying you a cloth or buying you a responsible thing, right? So this was how typical Indian life was for a middle class, lower middle class family person like me. Now, I was simply in a middle class family range because my dad was a government official, but his family life was from a lower middle class family range. So that's why he naturally didn't used to spend. He was a much more spendthrift than me. Whereas for me, when my salary decreased after a few years of living in US, I became a spendthrift as a result of my past, because I knew what it is to have less access to money. And then when I became a pharmacist and I had much more income and I was now in the middle class range of income in US, at a time again I expanded my expenditure according to the salary I was getting and according to the socioeconomic conditions related things I have to meet now. As a person who's working in a pharmacist, I have to dress up a little bit more nicely, more formally. So all those things started shaping up my life, right? So you have to learn, in order to have a balanced life, you have to actually learn how to adjust according to the shifting landscapes of our lives. But what happens most of the time when shifting landscapes are happening in our lives, many of us take a lot of time to shift according to our landscape. And when we take a lot of time to shift according to the current landscape of our life, which is not simply how much finances you have access to, not simply whether you moved from one country to other, not simply about the exchange rate of money from one country to other, not simply about what food you have access to in a different country, also not simply about what you are providing to your baby, given what you already know about baby's healthcare. And which is where the reason why I'm mentioning two babies in this video, because their parents are not attuned to the shifting landscape of what is necessary for parents to wake up to currently on earth. So what is necessary? While both set of parents are thinking that they are giving or have given their child the best possible care that was possible for them, while it is partly true that they are all giving the best possible care given the knowledge they have access to, which is based on the past history of human existence, both these set of parents actually didn't give their child what was necessary for that child's specific health needs and at the time when they are expressing a distress that is going on with them. So with the first toddler girl who was 2-3 years old and capable of speaking, but she's just barely learning how to speak, so she can sing a song that her parent is teaching her to sing. She can use words that she has heard her parents use, but she doesn't have knowledge about what is harming her health. So if she is getting harmed in her health, what are the indicators that will show when she is getting a harm in her health? Same way with a baby doesn't even have any gift of speech. What is the mechanism a baby uses when they are feeling sick? Crying. So when a baby is crying, when a child is showing some physical health distress, when you are a mom or a caretaker or a father or a grandparent of a small baby, it doesn't matter how old the baby is. It could be a 6 months old baby, it could be a 2-year-old toddler, it could be a 5-year-old child. But when you are a caretaker of any range child, and it could even be a 15-year-old child, doesn't matter what age you are caretaking someone or being a parent to someone, what matters more, if you really want your child to be, or a grandchild to, or someone, if you are a nanny of that person, if you really want them to be in their best phase of health, you have to meet the needs of that person under your care according to what that person needs for their caretaking, and give them that healthcare not based on what you previously knew about caretaking someone, providing healthcare support to someone, providing whatever you are providing to someone. Part of it comes from what you knew previously, but the major chunk of it has to be based on what is happening to them presently and what may unfold for them in their future if you do not anticipate a little bit further in their future what might happen to them slightly in the distant future of their life. And which is where having a balanced life is about understanding the past, understanding your current reality. It's majorly about understanding your current reality, and part slightly about understanding things from the past that can be translatable in the current reality, and also understanding, given the current reality, what is the future direction this child is going towards, to ensure that you put in some newer practices that will make the future reality a better outcome in the present for the particular child. Which is where many humans fail. They do not understand the connection between past, present and future. They do not understand how they are responsible for shaping the past, present and future of a child they are caretaking. If you are a parent, and it's similar like that, not just in parenting, but if you are a child also, given my past, present and future, I did certain things related to money, right? That's why I spoke about the money. Given my past, I didn't know how to be an extravagant person. So even when I had access to 1,000 rupees in my home life, I did, or more than thousands, I didn't go and simply spend the extra thousands, because I was just used to using only a little bit of 100, 500, occasional monthly 1,000 expenditure. Apart from that, even if there were 20,000 there in the home or 5,000 there, I didn't take the whole 5,000 to go and drink a beer with my friends or go to an expensive restaurant to celebrate my birthday. I never did that, because it didn't even strike me, because of my past, it didn't even strike me that, and I didn't have those extravagant friends also, so it didn't strike me that I need to go and spend some extravagant amount of money somewhere. Did I not have a birthday celebration? Yes, but my birthday celebrations were at the kind where I decided one day to buy groceries, to cook food for my friends at home, which is a cheaper way of spending money than if I give them, let's say I want to give them a party in a restaurant. If I invite 10 people in a restaurant or 5 people in a restaurant, I will have to end up spending that 5,000 level money possibly, or 2,000, 3,000 level money for the food I'm spending on them. Whereas if I invite them at home, I'm spending only 500, but my effort is coming from the cooking that I am doing, the service, that dinner service that I will have to do when they are at my home and I am hosting them. So I did that. And at that time, my mom not been a involved mom, my mom not been someone who would socialize much with people. She didn't even do any basic socializing, and I had also those friends in whose homes I have gone to celebrate their birthdays. So their moms were much more involved, their moms were much more entered, like, while they have invited their friends also for a birthday party in their home, their moms were the ones who were doing the hosting activity, whereas the children who invited me to their homes, those girls were just simply busy in socializing and entertaining and doing, providing the entertainment thing. But because in my home my parents were not involved, no one else was involved in the entertaining, what happened, I had to be the one to entertain my friends, I had to be the one to also serve food to the friends. So will I give them the best entertainment then if I am busy serving the food? No, right? My attention is divided in both serving them the food, serving them and observing what they need, what they don't need, and being the first time host. Because if you are a teen and you're hosting someone, you wouldn't know how to host someone as a teen, whereas if you are in your 30s, by then if you have hosted at least 10-20 people, you know how to serve 10-20 people. But again, if you know how to serve 10-20 people in a foreign country, it is a very different experience than serving 10-20 people in India. In India, there is a very different protocol how people expect to be served, which I always tend to fail at. And in US, there was a very different level of serving that I used to do when I was a grad student. So all these things, when I was a grad student, when as a single woman, how I used to serve, because it's a very different life. When you are a single person, you serve very differently. When you are a only person living in your life as a single person, then also you serve people very differently. When you are a grad student, you serve people differently. When you are a richer person, you serve people differently. But you can only change according to what is the circumstances of your life. And even if I was let's say socioeconomically at the same level as someone who is also having the same level of income, let's say I am earning my own money and there is another woman who is not earning any money, but their income is coming from their husband who has given them access to money, both of us will be doing hosting activities in a very different way, because I will be doing it in a more masculine feminine energy oriented way, whereas the woman who is completely dependent on her husband for finances would be doing in a more feminine energy oriented way, especially if her husband is very generous. And then there could be another woman whose husband is not generous at all, then she will be also having to do the masculine feminine energy balancing way about doing the hosting. There could be another woman whose husband is generous but doesn't have a high income, again she will do a different kind of hosting. There could be another where she has some access to money, her husband gives her some access to money, she will be doing a different kind of hosting. So depending on our socioeconomic status, how we were raised, what life journey we have led, the same activity is influenced by our past and our present. But while hosting in your present, if some problem happens, do you have to be adaptive while hosting in your present some problem happens? Which comes from where? Which comes from understanding that if something unexpected has happened, how do we adapt to it? How do we work in inculcating that in our life? Like for example, there was a event where a friend invited me. She was a very casual friend, but she invited me for an event. And when she invited me for an event, it was a baby shower event that was being hosted by another friend of hers. And those women, most of those women were housewives, so they had a lot of entertainment space to do certain things. And they had all these dressing protocols that everyone has to dress up in saris or extravagant clothes like how you see in Indian serials. But I didn't even have the time to watch Indian serials. I wasn't even watching majority Indian serials. I didn't ever spend even in my 20s my life dressing up like Indian serial bahus. So I never ever had that life where I even thought that dressing up like that is necessary or important for me. Very rarely would I dress up like that. And that day I didn't see an email from these people that there was a dress protocol you have to follow when you have to go to that event. And I was coming that day from my work. Now if I had seen that issue of dressing according to Indian clothes, I would have gone and brought a extra set of clothes and after work changed into Indian clothes and come to that event. Or I would have gone to my home, changed and then gone to the event. But because I missed that email, I went in my I just wore some nicer work clothes and just went as if I'm going to an American party. And I totally forgot that this was an Indian party. So that would have actually, made me think about going and dressing up like that. But because I was not invited to extravagant Indian parties, it didn't even strike me that I have to dress up in Indian wear. But after that, that same friend has invited me 3 times to 3 of her events, and slowly, because I know who are the kind of people she hangs out with. Again, I have had, and some events were also American events where we were just dressing up like normal Americans also. So I have attended both Indian events where Indian fashion is going to be present, and I've also been gone for like a dinner and a movie where we are just wearing American clothes. So in both of these, sometimes I have succeeded in dressing up appropriately, and sometimes I have just been average, and sometimes I have been completely inappropriate in a way I was dressing, simply because I was not used to doing those activities. So the first time we do something, we are not good at doing it, or we don't know the extent to which we can do that well, or the extent to which we are failing at doing it. So I'm giving this context about my past because this video is not to make a person who's caretaking a child feel shame that they are not doing their job or they haven't been doing their job well. It's just that you don't have the context about the job you have to do currently on earth. Many people don't have the context of what they have to start doing, and many people also, given your family circumstance, socioeconomic circumstance, understanding of the past history related to child caretaking, sometimes people are resistant to understanding what is shifting in child caretaking that needs to be addressed. And I've made a video in Hindi about this related to sudden infant death syndrome, as well as shaken baby syndrome, as well as health parameters that can impact a baby's life. I'm making the video in English for those people who have to understand deeply now what I was trying to show. If you know Hindi, you can watch my previous videos also. But there is a lot of things going wrong with children's health currently on earth. Not just children's health, actually speaking, globally multiple levels of healthcare is failing or not failing to not recognizing where they are starting to fracture and not fill the gaps of healthcare that they were meant to fill or start building on. But because the unawareness is there, mistaken awareness is there, mistaken understanding might be there, the deeper levels of work that people have to do is not happening. And people have to do in relation to a baby's caretaking, a person has to do it both at a familial level. If you are a caretaker as a family of a person you are caretaking, you might have to do it as a supportive care level. If you are a nanny supporting a child care event, or if you are a babysitter doing some child caretaking, and you have to also do it at a healthcare perspective level if you are working in a healthcare setup like a clinic or a hospital where you will be taking care of a baby, or you are the working professional in a ICU, you are an administrator of a hospital. Everyone has to wake up. In recent years, also there was another incident, maybe I will put that also in, which I saw recently, which is related to a fire that that burnt babies in a clinic in Madhya Pradesh, I believe. That incidents, while it has happened at a healthcare operational level, and I will make a video about them also, but not possibly in this one. I'm not sure whether I'll get the time to. address that issue. But let's start with the simple issue of these two babies, who I will reference and put in my reference video here, because their physical distress is visible in their video. Now, the 3-year-old, 2-year-old toddler, while she's singing a song very effortlessly, her chest was heaving, and the way her chest was heaving was showing some cardiovascular or circulatory system or respiratory system distress. Now, having had that distress, she could have been taken to a doctor, and a doctor could have prescribed the normal medicine someone gets when they have a respiratory distress. And at that time, what are the normal medications children are prescribed? They might be prescribed a corticosteroid inhaler to help, like if they are having a wheezing like condition happening, to open up the passageways of their respiratory tract, or any of the bronchioles that might be choking up or constricting, causing her the breathing distress. They would give a corticosteroid to cause a relaxation of her muscles. So either a corticosteroid might be given, or a beta blocker, or different inhalational medications might be given depending on what is currently known about medical interventions, and what was currently known about most medical interventions when you have respiratory distress is involved with relieving the physical health symptoms of the respiratory distress, giving chemicals that will help in either reducing, and sometimes the thought or the presumption is the reason why corticosteroids are given is not simply because they will help relax the bronchioles, but they will also reduce the inflammation. So indirectly they are helping you relax the constricted, if let's say you have an infection going on or an allergy going on and inflammation is going on in your respiratory tract region. At that time, any of the organs really involved in your respiratory system, if there is inflammation going on, giving a steroidal anti-inflammatory agent like a corticosteroid helps in reducing the inflammation. And when the inflammation is reduced, if you were choking up because inflammation was present, you get the immediate relief. If you were choking up, if some muscular activities were going wrong, that's when alpha blockers, beta blockers, those kind of medications are useful. Sometimes if you have like gunk in your nose, at that time also some saline solutions might be used by some people, not for small toddlers but for a little bit older people, or people sometimes use for toddlers also these nasal syringes that help in extracting out along with some saline solution. People can also extract out your if you have mucus accumulated and if the mucus is causing your health distress. So all of these are the known things. At least 10 years back, these were all the known things that were being practiced in US healthcare as a measure for combating respiratory illness in smaller children or adults. Everyone usually gets these typical medications. If you have allergies going on, you will get also anti-allergy medications that will reduce your allergy symptoms. But all of them or most of them are symptomatic treatment of the disease you are going through or the illness you are going through. But now, while on a cleaner earth or at a person whose life conditions were much more health supportive, simply relieving the symptoms was enough to give the child or anyone suffering from a respiratory illness the time to recover from their illness. Currently, the problem is not simply that you're not giving someone intervention as to cleaning their lungs properly by using these nasal syringes, or giving them the chance to clear their lungs by reducing their inflammation, by reducing their muscular constriction and wheezing related activities, coughing related things. instead of relieving all this, which is already been given to someone, or if a good doctor is there, they would prescribe all the necessary things that they can see that the child is suffering from. And if a responsible parent is there, the responsible parent also might be giving the child the right medications, given what is currently known and has been practiced in the past regarding the healthcare practices, that the child has to be given according to whatever the current medical protocol is. But even if you have given a child all the best possible medical protocol necessary according to whatever you know about current status of healthcare, the issue now with this child is, while she was possibly taking medications for her respiratory illness or whatever else that was going on with her, while she was now at a status of health where, because she has been given some right medications to relieve some of her symptoms, she's able to sing well. Because I have had health issues when I couldn't, and respiratory and cardiovascular and circulatory system combined health issue, which was causing me respiratory distress, cardiac distress, severe breathing problems in highly polluted places, either inside my home or outside my home. And at that time, if I took a medicine that is relieving some of my symptoms, while I was able to breathe freely, there were other things still related to the cardiovascular and circulatory symptoms that were still cropping up in my body, because I needed care related to all three systems, not simply respiratory system. And I also needed some deeper care, supportive care, preventative care, without which my symptoms wouldn't completely alleviate. And I also didn't get complete medical care, and because of which my symptoms never went away, even though now 4-5 years have passed since some of these symptoms started initially showing up. And I was having very similar symptoms to this child's. And in that symptoms up and down phase that I have gone through in the last 5 years or few years of my life, this symptoms up and down phase that has been going on, the up is happening when multiple factors are impacting my respiratory health. The down is happening when and better breathing is happening when lesser number of factors impacting my respiratory health are impacting my health. And in that up phase also, let's say I have pesticides that are choking up my pesticides in my food that are choking up my muscles in my respiratory tract, or pesticides in my air which are causing the choking up of my respiratory tract. Just simply taking a steroidal medication, allergy, or something that is causing allergy in my home environment, like dust particles in my home environment or mold in my home environment, all of these were impacting my breathing function, cardiovascular function, circulatory system function, depending on the depth at which that particulate matter in my home environment is causing my health distress. So similarly, this girl also has some home environment conditions, lifestyle based conditions, that is causing her to breathe in an abnormal way, which is visible in that video. But along with her abnormal breathing, because she is also taking medicines, some of her breathing problems have been stalled by the medicines she was being given, because of which when she's singing, she is able to sing well. When I was at a really bad respiratory or cardiovascular functioning phase, at that time I was not even able to sing properly, or I was if my breath could have lasted for a long time, my breath was not lasting for a longer time than I used to be able to sing, simply because I was having some health issues going on with my health. Same way, her treatment is not complete, but because partially it has brought her relief, she is able to sing this song. But because it has not brought her complete relief, her lungs were showing some distress in a way. The lung was moving, her respiratory organs were moving while she's singing, and that distress can't be relieved simply by medication. While medication is relieving some of the inflammation, relieving some of the blocking and choking of her respiratory tract, but what that same medication is also doing is, when her lungs are now clear of inflammation, clear of mucus, lungs and respiratory tract and respiratory organs, when they are getting clear as a result of the medicine she is getting, if in her environment she is consuming drinks which may have pesticides or some other chemicals that are going to be harmful for her health, if she is breathing air which may have mold or some fiber from the sofa, or her parents are using chemicals that are distressful for her health status, all of these are going to still continue her health problem if none of us is aware what is the root cause of her breathing distress. Because the medicine has cleared away the past distress, is trying to clear away some of the present distress, but the ongoing continuing distress that is arising in her life from different conditions in her home environment, they're all continuing to give the distress signals that her body is giving. And in fact, if you are overly medicated, sometimes some of your distress signals are also misinterpreted, meaning for me, this was the safest thing when I didn't actually get healthcare interventions, because multiple healthcare problems were going on with my life and multiple things were impacting my cardiovascular system and circulatory system's functions. And because multiple things were impacting it, and I had gone and done a lung test, and where the lung function was normal, but other functions were showing the distress symptoms. So it wasn't a respiratory system malfunction for me, but it was showing up as a respiratory system malfunction occasionally. Whenever I was in my home environment, where my home might have mold, home might have fungus, home might have particulate matter from the soaps that have been used in cleansing our clothes, home might have some pollution from the construction that is going on in my neighborhood, all these things were impacting my home air. And now in India, most of us do not use ACs regularly, so we have the home environment in a way where whatever we are breathing is whatever is present in our neighborhood and homes, right? That is what we are breathing, because the AC filtration system is not filtering out anything. So what was happening, I was getting distress in breathing at home, or cardiovascular distress was actually showing up, because my major organ that was impacted was my cardiovascular organ. So my cardiac system was getting impacted, but it was showing up as a breathing distress and a cardiac distress. But when I was going to the doctor, by the time I am taking an auto, going to the emergency room and sitting for 10 minutes in the emergency room, if my home environment had the worst kind of chemicals and mold and other things leading me to feel this distress, by the time I'm out there in the open, I had a little bit better air quality at that time, some days, because it was during the lockdown period after 1-2 years of COVID, when I had gone to see the doctors. So now after 1 year of COVID, when I'm going to the doctor and there was lockdown going on, so less number of people were outside on the roads, naturally the air quality outside my home ended up being a better quality than the air environment inside my home. So my lungs and cardiovascular system got a relief. Like if there are, let's say, 10 pollutants in my home life, or 5 pollutants in my home environment, while I'm on the road, there was only one pollutant, which is the pollution related to vehicle traffic. And because lockdown was there, much less human activities were going on, so all the other factors that could lead to air pollution in the roads was less. So while I'm traveling on the auto, my lungs, now having only exposure to one chemical, immediately now started breathing a little bit more clearly. Then when I went, and even because my lungs are now breathing a little better, my cardiovascular system is getting more oxygen, it is also now in a little less distress than how it is when I was in my home. But by the time I went to the emergency room and I sat for 15 minutes, 20 minutes while they are checking out other patients, in that time, now what does the hospital have? This I know because I'm from a I'm a healthcare person. I've worked in hospitals, I've worked in clinics, I've worked in a pharmacy. I was also a pharmacy student, so I know what kind of filtration systems or devices are used in these kind of healthcare setting facilities where manufacturing of drugs are going on, where patient care is going on. So what did they have? They had high class filters, much better quality filters than the filtration of even the AC in my home. And in my home I didn't used to use AC every day. So obviously if I don't turn on the AC every day and I'm only turning it, let's say, for a few hours during the summer time, only for a few hours I'm getting the filtered air, but for the rest of the time I'm still breathing all the particulate matter from my home environment. So having breathed all that, the 5 particulate matter from my home environment, and then only breathe 1 particulate matter while traveling in a auto, and then when I finally went to the hospital, I'm not breathing any bad particles at all, because all the particulate matter related to fibers, chemicals, pollutants around that area, everything is, and that hospital also was actually in a high traffic zone, so that hospital also has a very much high chance of having particulate matter from vehicle pollution accumulating in its vents. So when the pollution levels are lower, or if they have good filtration devices, all the pollution from the local traffic also is not going inside the hospital. So considering all those things, now what is happening, my breathing has relaxed even further. So my breathing distress has now visibly gone away, because I've gone from 5 particulate matter impacting my lung functions to only 0 matter, nothing is there that is impacting my lung function. But while nothing might be impacting my lung functions, some of it has still accumulated in my cardiovascular system. That's why my cardiovascular system is showing distress. So at that time my cardiac rate had been, the reason why I panicked and went to the ER was because I was feeling that I'm choking, and I was also feeling like my heart rate had gone up like above 150. But by the time I reached the hospital and my pollutants had lessened, that same 150 heart rate had now gone down to 130, and for them 130 was not a distressing signaling. Or while I explained to the technician, the technician understood that why this is still a distressing, not a like when the technician monitored me it was at 130, and when the technician monitored and it is at 130, he was going to also ignore me. But I had already tried 1 or 2 visits before that also with the same heart symptoms, but the technician, that's why now this time had a better knowledge. So I tried to convince the technician all these things that I've mentioned in this video. I tried to convince the technician about that. But when I'm trying to convince the technician about that, while the technician understood the context of what I was saying, he either didn't explain it to the doctor, or even if he is explaining, if the doctor is not like understanding that the technician might give him a good valuable insight about the patient's health, he will either ignore what the technician is saying, or still just be looking at the patient based on the current status of the patient. And by the time the technician now spoke to the doctor and a doctor was available to take care of me, again a few more drop in my heart rate had happened. So now my heart rate, when the doctor is checking, is even more lower. So the doctor is thinking this is normal heart rate range. So the technician is wrong, or technician might have recorded wrongly. The doctor could think that. I tried to convince the doctor, but the doctor didn't have enough time to listen to me as a patient, or listen to all these things I'm mentioning in this video, because none of these was possible in a ER setting. So they just completely ignored looking at the current status of mine. They just released me and saying you don't have any problem, when I in fact definitely know I was having problem, consistently having problem, constantly having problem. But that one trip only to the doctor and then coming back, because I was not in good cardiovascular and circulatory system related health, As soon as I came home, I got tired. I do not have the energy now to go again to pursue this again with in a ER sitting. I'm able to at least see the doctor in maybe 30 minutes. But if I don't go to a ER sitting, when I also took a appointment for a lung related doctor who was a renowned lung doctor in this area, and by recommendation from friends and online reviews, I even set up an appointment for a lung health doctor also. But as soon as I went to that doctor's clinic, even though I had a set appointment time, I saw that there were a lot of patients ahead of me who were waiting there. And this is the Indian system of healthcare, or even in US this can happen sometimes, that even if you have an appointment at say 7 o'clock in the evening, and there are other patients sitting there, your actual appointment will not happen with the doctor until another half an hour or 1 hour. And in that clinic setting, they didn't have possibly better quality filters like a new hospital has. But the second thing is, they were also using, because of COVID, a lot of cleansing chemicals in their environment, but they were all highly toxic cleansing chemicals. So I couldn't even just sitting there for 5 minutes was heavily distressful for me, who was at a sensitive precarious stage where even 5 minutes exposure to toxic chemicals was causing breathing distress and cardiovascular distress to me. So I immediately, even though I knew I had an appointment, I asked them also how long will usually this thing can take considering the number of patients. And they said you will have to possibly wait half an hour, 1 hour. And I could see also, because I know how long it takes. I have worked in hospital and healthcare, and this is operations related work was my work, so I know the timed thing also about how long a doctor's visit takes in any country. In general, intuitively also I know, and in practice, while doing my healthcare internship in a hospital, I had actually practiced this aspect of healthcare wait times and things like that. So both intuitively as a patient, I have experienced it in India and US, and in US healthcare I have experienced it at a work level. Operationally, I know how long it takes. So I knew that even if they are saying they said it will take half an hour, but I could see there were at least 5-6 patients before me, and all of them, even if they were given at least 15 minutes, 6 patients will take at least 1.5 hours for good diagnosis. And if it was quick diagnosis also, then also it will take at least minimum 1 hour. And my lungs couldn't take that 10 minutes, my cardiovascular system couldn't take that 10 minutes of distress sitting in that hospital setting, clinical setting. So I told them, please cancel my appointment, and I left that facility. Because while getting the right medicine, getting the right treatment is important, if I know that I can't even sit through 5 minutes, and I will likely, if I sit there, my body was signaling to me that if you sit here, you will likely get a heart attack, or you will likely faint here, and worse health outcomes will emerge for me. And that worse health outcome, I didn't want that worse health outcome to emerge, because at that time I was having some financial blockages because of multiple other reasons, and I knew I couldn't afford expensive healthcare. So the safer option was go back home and just manage it whatever way I am already managing it, which is trying to minimize all the chemical usages that are giving me breathing distress. Because it was not simply the scents or highly chemically infused cleansing agents, like they were using all simple I don't even know the brands that are available in India, but Lysol is, I think, one brand that is available in India. So Lysol, phenyl, all these things that are typical cleansing agents that are used commonly in Indian homes, Indian hospitals, Indian hospitality industries. Everywhere these chemicals are very commonly used, but people don't realize in these commonly used chemicals only some health harming things are present, which right now, if not diluted the right way, if not used in a very minimal way, is also impacting people's health. And not just that, there were some patients who were also wearing scents when they are, we use perfumes and scents and deodorants and colognes or aftershave lotion. All these things are also very commonly used by all of us. And for me, when I was at that peak distress time, all of these chemicals were also highly distressing and highly difficult to manage my health when I was in the vicinity of anyone who's spraying a lot of chemicals on their body. So at the time, because of all these reasons, some patients were wearing things that were highly difficult for me to breathe in, and I could stay outside on the road of that clinic for a few minutes until my appointment time came. But in India, this is another problem. If people don't see you waiting inside in the premises, they start challenging you, fighting you. Like, say, if I stayed outside for 15 minutes, what happened? As soon as I'm going inside, by then another 2-3 patients have come in, and they will not allow you. Like, if they didn't see you waiting, they will say, why I didn't see you waiting. So all these, I know all the challenges of waiting time, waiting related issues. And then when I was standing outside also, the area where this hospital clinic was, that area also didn't have good air quality. So I was having, while in the clinic, I was getting more cardiovascular distress. Outside in the normal streets also, if I have to wait on the streets also, it wasn't anything greatly better. And at home also, what I was facing at that time in my home life, I had managed to reduce some of the health impacting factors in my home life. So actually it ended up being that day when I had taken an appointment with a doctor who could test my lung functions and test and do some respiratory related diagnosis and treatment, at that time my home conditions were better than the clinic or road conditions. So I just took a auto and came back home and rested at home, and continued doing all the preventative care strategies I could do given the conditions of my current life at that time. So, and all these incidences that I'm mentioning, they have happened not immediately, like every month or within a few weeks, but they are all incidences that were transpiring over a period of 1-2 years, related issues I am telling you in these videos of mine. It's not simply that something unfolded today and then the next thing unfolded next week, because that will unfold for whom? Someone who is a hypochondriac, someone who has really good physical health status to keep going again and again to a doctor, or someone who is also financially that much secured to keep spending money in different doctor appointments. And all of which were barriers at that time for me. And one of the barriers related to banking was I forgot my passwords because I was sick. I didn't remember my passwords. Then when I was trying to remember my passwords also and trying to change my password, some other blockages came up. But at a time in the banking system also, some other hurdles were going on. So the banks were, because of COVID lockdowns, they were overbooked, overworked. So some activities related to these password changes, related things, they were not addressing those issues at all. They were all the urgent issues. While for me, the password issue was an urgent issue, because if I don't fix my passwords, if I don't fix my cards, I can't, I have only some cash access. So with the cash access, I had very minimal access. I was living with family who were not understanding, even if they had cash access, even if they have currently cash access, card access, they are the kind of people for getting them to spend even 5 rupees on someone or 500 rupees on someone is a pain. So because of which I was stuck in a place where I didn't know what to do. So I was doing whatever was possible with less money, whatever was possible with preventative care, and whatever was seeming like a more health safe alternative than a health worsening alternative. There were a time when I was in a heightened allergy phase, I had taken allergy medications as well, but the allergy medications were not relieving all of my problems, and in fact were worsening some of my problems because of, again, home health conditions. And that's why the medicine was worsening my health than bettering my health. So similarly, with this baby who is a 3-year-old baby who is experiencing a breathing problem, getting treatment for it also, because it's not completely relieving her of the main things that needs to be relieved in her life, if that baby really has died, or any baby like her, let's say this is a false caption video, but if this baby didn't die, if there are other babies like this who have indeed died after expensive treatments or normal treatments, there is a reason why that is happening in them, and that reason is all these things that I'm talking about that impacted my respiratory and cardiovascular functions are also, and even possibly my circulatory system functions, because they were all developing slowly over time of exposure to some of these chemicals and particulate matter in my environment. So if your home is filled with mold, or some part of your home has some mold accumulating there, that mold, while for a 50 pound child, or for a 110 pound adult, or for a 180 pound adult, if 4 people are living in a house where there is a small 10 pound baby and a 50 pound child of 8-10 years, and there is a mom of 110-20 pound weight and a dad of 180 pound weight, whatever is the range, or somewhere around there their weight ranges, if there is mold there in your home environment, who is going to be the one most impacted by the mold? The smallest person in that family will have the most impact from the mold, because they are the smallest in size. So if there is even 1 millimeter mold in a home, that 1 millimeter of mold will not impact the breathing or functions of a 150 pound or 180 pound man. But the same 1 millimeter mold, when the child is like almost 100 times smaller in size, that itself will impact the child's health in that grander scale. Plus, along with that 1 millimeter of mold, if there is 1 millimeter mold in your bathroom, 1 millimeter mold in your food, a little bit of mold in your drinks, or pesticides, are some amount of pesticide contamination is happening in your drinks, because some of the ingredient used, like let's say it's a smoothie, you're giving a strawberry smoothie thinking that this smoothie will be healthy, and I choked a little right now because this has been happening to me. Like, I order sometimes strawberry smoothies from local stores, and now if their water or ice or the strawberries or other ingredients used in making the smoothie has some chemicals now which are impacting my health, and let's say already my body is toxed out from multiple chemicals and microbes impacting my health, at a time when one additional amount, even if it is a 1 microscopic amount of pesticide, 1 micromillimeter amount of pesticide, 1 microliter amount of some chemical that is polluting the water, some whatever it is, whatever chemical is it that has polluted the strawberry use, that has polluted the water use, that has polluted the other mixing ingredients used there, whatever it is, even if it is at micro level, nano level, millimeter level, very very tiny, invisible to human eyes level, but if it is the last amount of toxin that my body can take at that time, my body, if it has consumed that strawberry milkshake, inhaled something from the air environment, if my parents are wearing colognes and aftershaves and perfumes, or makeup with perfumes, or shampoos with perfumes, if the baby was also using shampoos and baby washes with scents in them, if the baby's clothes had scented products that have been used to clean their clothes, all of these are multiple avenues from which some chemical toxin is getting either absorbed by the baby, inhaled by the baby, drunk by the baby, eaten by the baby. And in the video we can only see a cup filled with some drink. So definitely that drink could be having something that could impact that child's health. But it is not simply the drink that can impact the child's health. Even a molecular particulate matter, even in their medicine, could be impacting their health if at that time their health is at such a precarious status that any microscopic nanoparticle amount of something will impact them. So if she was already in that physical health status where, while the symptoms were getting relieved, but internally multiple other things were going wrong with her health, like some cardiovascular and circulatory system damage was going on, whose distress was showing up as a lung distress, but the main distress was going on with her organ system malfunctioning as a result of exposure to chemicals and microbes in her daily life, and the exposures coming from multiple fronts. So when the exposure is coming from all these fronts, like again for her also, if say 5 elements are there that are causing her health distress, one is coming from the strawberry she has eaten, one is coming from the water source that was used to make the ice. Like in ice, I have found that some ice can have ethylene glycol or whatever is used to make the ice chemically in a refrigerator. That refrigerator's chemicals could also impact the quality of ice being made, and that ice will not be just pure H2O, but it will be H2O plus some chemicals that are used to make that ice. So that ice can also be toxic. It could be the food that she ate before this video was made. It could be the scent that she inhaled much before. 1-2 days she might have been inhaling some scent from her clothes or absorbing some scented thing from her clothes. It could be the scent from the bed sheet she was sleeping on at the night time. It could be the scent from the sofa cleansing agents that might have been used in her homes. It could be something related to just particulate matter in her home environment, which maybe is not distressing older people in her family, but for her it is distressing. So all of these are all getting inhaled by her. And why was she having a breathing distress or inflammation in her lungs or in her bronchi? Because that inflammation was occurring because every time something toxic is getting inhaled by her, or after absorption via the circulatory system is also getting some of it is going into her lungs, because remember our body is an interconnected network. So if I have also drunk something chemically poisonous to me, first it will go where? It will go into the gastrointestinal tract, but from the gastrointestinal tract it is continuously getting absorbed by my body while it is traveling down from my mouth to my rectum. In this whole area the thing is slowly getting absorbed in different parts of my body. So some of it might have been absorbed by my esophagus. Some of it might be absorbed in my stomach. Some of it will be absorbed in my small intestine. Some of it will be absorbed by my large intestine. So different parts of the body and blood vessels are there around these. So wherever blood vessels are there, it gets absorbed and it gets into my bloodstream. And after getting into the bloodstream, after the medication is there into my bloodstream, again via the cardiovascular system's functions, eventually some of the toxin will land up in my cardiovascular system, in my lungs, in my liver, in my kidneys. So all these toxins, even if it is inhaled, the inhaled toxin can land up in my kidneys or in my liver. The inhaled thing can go to my brains. The inhaled thing can go to my skin, because this is how our body is connected. While the primary function is from inhalation, it will first go to the lungs and respiratory tract organs, and then go to the cardiovascular system's organs, and then go to the other organs. So it is going via multiple pathways to different places. Does this make sense? So if I inhale something, from inhalation also it can go to my skin someday. If I have absorbed something, from absorption also it can eventually land up in my lungs someday. If I have eaten something, after eating also, or drinking something, then also after biochemical process has happened in my body, it will land up somewhere in different parts of my body, and I wouldn't know where it is landing up unless I'm super aware about my health. And as a baby, are you going to be super aware of your health? No. But what will you be showing? You will be showing the symptoms of where that chemical or multiple chemicals, or chemicals plus mold plus particulate matter in your home environment, all of these are accumulating. Where it is accumulating the most, or where even after accumulation, even if it is, let's say, accumulating in my hearts the most, while heart is only occasionally showing that increase in heart rate, majority of the time it's the lung related functions that were actually showing the visible functions to me. So that is what was happening in my body. That is what is partly happening in this baby's body also. But because the deeper implications of how the things in her life are impacting our health is not known by doctors, not known by healthcare professionals, not known by most doctors, most healthcare professions, most people who caretake a baby, none of us are aware, or very few of us are aware, that every single choice related to our lifestyle and choices even on the medications they have been given could be, and the way the medication was administered, even that can impact a child's health as well. Like, let's say she was singing, and after singing her doctor had prescribed some injection for her, or after singing she started coughing, and when she was coughing maybe she was given a nebulizer to help with her coughing. Now if the mom is now using a nebulizer, also nebulizer needs some water in it, and that water that you're using for the nebulizer, instead of, maybe the instruction says give her distilled water, but you didn't use distilled water for it, or even if you did use distilled water, it was expired distilled water, or it was some distilled water with still some chemical contamination problems, whatever it is. Or there are multiple areas where, again, if while administering a medicine also some mishap happens, then also her medicine usage itself could lead to health issues. Or if you're not giving them a nebulizer, there is some medications like Spiriva, where you put a capsule, the capsule is crushed inside the medicine's box, and after the capsule is crushed inside the medicine's box, you inhale the contents of the gas that is released from the medicine. That gas is then inhaled by the person who is taking the Spiriva like medicine. But again, there also, while inhaling the gas, if any of the core ingredients in Spiriva has got contaminated for some reason, or the inhaler itself, there are some cleaning protocols, and while doing the cleaning protocols, only some chemicals have been added that are additionally harmful to that child. Again, any nanoparticle, microparticle exposure also to a toxin in a child that is already in severe health condition, distress, which other people are not understanding, but her body already knows that this is the last chemical. So when the body knows this is the last chemical, at that time, that last chemical, that it's like a penny dropping in a ocean. Like, you can keep dropping multiple pennies in a, like, have you all ever done all these different fun games where people, not even penny, like, let's assume there is a cup. In a cup, have you seen all those games people play where people are pouring, and the last person who will pour a drink in that cup, if that cup spills over, they lose the game, right? So many a times, have you seen how the cup gets filled slowly, and even for 1 or 2 millimeters extra, the cup can sometimes be filled. So you can go a little bit above the capacity of the cup to do some function. So when you are sick, at that time your body is in that distress mode where it is stretched itself to do some functions a little bit above its capacity to do some function. So if the cup can hold 500 ml of a drink, but because of slowly pouring, and the way it is poured, and the way the liquid is accumulating on the top of the cup, 501 ml can possibly be accumulated on top of a cup. But the moment it has gone from 501 ml to one even extra drop of liquid, immediately it spills over, and every cup will have a different level of spillage. Sometimes just 1 drop will be needed for the spillage to happen. Sometimes 2-3 drops will be needed for the spillage to happen. Sometimes the force with which the drop fell can cause the spillage. Sometimes the different things, like, if even, while you were dropping the liquid, at that time, along with the liquid, some fiber from your cloth also got attached to that drop and then fell on it. Is it just the drop of liquid that is causing the spillage, or is it the drop of liquid plus the fiber that caused the spillage? So this is how the lung function problem of the child was, or cardiovascular, lung function, circulatory system, plus organ damage related problems that were manifesting in that possibly dead child was. Now, whether that child died or not, I don't know. But any child who is showing these kind of distress, you have to start now realizing that there could be multiple things in your home environment causing that distress to that child. if now you become a mindful caretaker, observant caretaker, less self-obsessed caretaker, more child-focused caretaker, then what will happen? And you're not paranoid. What I'm talking about, people will think this is paranoid way of thinking, but this is not paranoid way of thinking. This is the practical reality of life of certain people in certain cities and certain home life, where indeed 5-10 different harmful things are going on in their life. And if you don't recognize what are the harmful things going on in your daily life practice and choices, every element of things you didn't recognize continues adding to this health distress. So drop by drop, while initially when they were sick, maybe their lung capacity was getting overfilled, their lung capacity is up to 500 ml, but they were at 450 level, but the distress had already started happening because the lung was getting stretched for doing its normal function. Because that distress was happening, the lung decided to choke you or cause inflammation to prevent entry of the chemicals that are harmful. But while the lung was doing that, still the entry was happening not via lungs, or when you gave medicine, the lung is also now absorbing, inhaling all the toxins. Plus, if the clothes are also absorbing, if the food is also food consumption is also leading to the problem, because food consumption problems will first show up in the stomach, later show up in other organs, right? Or first end up showing up in a liver if the liver is distressed. So like that, wherever the chemical is first getting impacting your health, that's where the first distress signaling will show up. But if it has already started impacting your health at multiple levels, the time when enough of it has impacted the entire body is the time when someone can end up with death, even despite getting medications to stop them from going towards death. Does that make sense? So which is what might have transpired for that child, if that child died. And if there are other children who, despite getting medical care, ended up dying, this is one of the reasons children can end up dying, which people have to awaken to, because we need every degree of place that I've mentioned where you can have health harm. All those levels of clean life has to exist on earth before any child will not suffer as a consequence of the conditions of their life. Similarly, this is a long video, but about that first child who the breastfeeding child, I'll make a part 2 video because I'm getting exhausted. I still have my cardiovascular system problems, so I will make a next video about the breastfeeding child's issues, because this is too much information to process. But if you don't process this information step by step, it will lead to much more deaths, like how this child's death has happened, or how sudden infant death syndrome happens, or how shaken baby syndrome happens. They're all interconnected reasons, and while I can see the interconnectedness of the reasons, and I can tell you the simplest solution also, I can tell you, like stop using your harmful toxic chemicals in cleansing agents, stop using perfumes and inhalational thing that gives you headache. If it's giving you headache, it might give your child headache plus other organ damages. If you are using something that is causing you sneezing or watery eyes, that same thing for a small baby will cause some other 10 more symptoms than it is causing you. If the baby is showing breathing distress, it doesn't simply mean giving a medicine will stop the breathing distress. Doing some preventative attention, giving to the child to see what in their environment is leading to their breathing distress will be a more health supportive thing for the child. Becoming mindful about what you are doing in your daily life, daily choices that is indirectly impacting the child's health will also end up eventually helping the child heal, if you stop doing those practices that are indirectly or directly impacting their health. So I hope this made sense. I'm sorry for making larger videos, but if I make the shortest videos, don't do this which I have made in my Facebook posts. No one understands the implications of why someone is saying don't do this, because people are very much attuned to not thinking that if someone uses a negative word like don't, there is a problem in society currently where people don't understand why we don't have to do certain things, why we have to stop doing certain things, why we have to change certain patterns of already normalized things that in the past might not have harmed others but in the present is harming many people. I hope it made sense. Again, if anyone has any questions, comments, if I confused you with any of the analogies I'm providing here, please ask a question so that I can clarify if something is not clear in this video. Thank you very much. Have a great day.